It's a pleasure and honor. Thank you for being with us. The stage is yours.
Wow, Georgie, this is way too kind. Thanks for having me. You only have to tell me how I can share my slides because the button doesn't allow me to share anything yet. But meanwhile, I'll explain that you never should trust or believe someone who even thinks he can predict the future. You can never do that. But I fully believe that we are able to create the future, and that is what I'm going to try to do today. Show a few things which together with, well, the fantastic crowd, and I've heard part of the discussion just before, super interesting topics. I think we can, well, combine a few of these topics together and see where we land. So that's my starting point. We cannot predict the future, but can we look from an empty page? And to explain why I think sometimes that helps, I should explain a little bit what my background is. I'm trained as a molecular oncologist, so I've seen cancer patients. I've had the honor to elucidate the molecular reason why some people get certain cancers. With a fantastic team in Leuven, I have managed to develop a humanized antibody to treat brain cancer in children. And to be honest, more confronting than a child, 6-year-old with brain cancer, it will probably never get. And the best we could do with these children is send them on a camp. And that camp was called Camp Delight. And that word is something you're going to hear back a few times today. Because just like I heard at the end of the discussion earlier, changing the world is not about technology. But changing the world is about changing, well, dealing with change and providing people such a cool experience that you look forward to be part of that change, and then we'll find technology to do that. So imagine we could build a world in which we get sick no more. And we make that such an aspirational goal that people say, well, why not? We want to be part of that new page and we want to start building that together. And you might find that pretty naive, but I think I'm going to try to convince you that we can do that because we've been there more than 2,000 years ago. In some parts of China, the doctor was being paid as long as people in the village remained healthy. And once you got sick, you no longer had to pay. If you think about ultimate value of outcome-based healthcare, this is the coolest system you can build, right? And so far, I haven't met anyone who's against this. The only thing we have to find out is why we lost that model. And we lost that big time. And I think this is the reason why we lost it. If we look today to doctors who use drugs, well, they use them, partly understanding what they do. They buy them from pharma companies, trying to cure disease, of which they know even less, into patients they know nothing about. And with all respect to the doctors here in the room, a doctor knows nothing of his patient. A healthcare provider knows nothing of his patient. Let me try to explain. If I send a package from where I live in Antwerp, north of Belgium, to Sofia, I can go to the FedEx or TNT or DHL website and I can trace my package every 5 seconds, right? My kids completely freaked out during Corona if a package which was supposed to arrive at 11 was not there yet 11. And nevertheless, my patient, my cancer patient, Alzheimer patient, diabetic patient, is 8,750 hours a year by himself, not linked to me as a healthcare provider. So a FedEx package is better than my patient, and that is not normal. And that is exactly what we're going to change. I think if we're able to enter into the real world, 8,700 hours of our patient, and provide him, her, with completely novel experiences, which make that life richer, more exciting, then I think we have a way not to wait till we get sick, but to anticipate and basically even to prevent. And yes, part of that will be by moving digital, where digital is basically a 3-steps rocket, a 3-tier rocket, where we are currently in the phase of digitization. We get information from the facts into a database. We're digitalizing, streamlining process, but the real digital transformation, well, that's only happening now. And the fact that only now we start to have a discussion in healthcare whether healthcare should move to platforms tells me that there is still a big delay between domains which made the move and a domain like healthcare, which is about to really move into the new era. And so what I'm going to try to do today is show you three, I call them guardian angels, which we're going to use to be with our patient in these 8,700 hours, trying to be there invisibly, but always present, so that we can use omic data, sensor data, social determinants of health, let me come back to that in a second, to use, well, smart intelligence and to create really new experiences. And the ultimate experience closest to magic, but still real, is called delight. So can we make healthcare delightful? And so if we're going to use these bits and pieces of tech, the view I would like to propose is one in which we're going to clone the Chinese doctor from the past. Imagine that all of us, patients today, citizens tomorrow, have our digital doctor with us all the time. A kind of digital twin of that Chinese doctor, an avatar which is always with us. And I see you think, well, whoa, an avatar, come on, what is an avatar in, for God's sake? Well, I'm going to try to explain with the following visual. This is a picture from the coolest hospital in Europe, to my opinion. This is the Children's Hospital in Helsinki. And the first thing you see when you enter the hospital is a huge aquarium full of fish, which are drowned by children. Here to the right, the fish after drowning is being scanned in this small little device, and it goes via the tube system into the big aquarium, and basically the kid is present in the hospital. Cool, not a gimmick, delightful, yeah, but the real cool thing is the following. Once I enter the hospital, I'm no longer Koen Kas. I can pick an avatar. I can select who I am. I will be the biggest white rabbit with the strongest teeth and the biggest ears, right? And at the time I have to see my doctor, they're not calling Koen Kas. They're calling, yes, the strongest rabbit with the biggest ears and the strongest teeth. I'm completely destigmatized. My avatar becomes my second life, and that's how I move on. And that is exactly how I think we're going to be able to build a new world. We're going to provide kind of extra identities and keep people healthy. And the real trick is this one. A methodology we developed called delight thinking, which is based on the following. In the graph you see in yellowish my bucket list for my birthday. This is all the presents I would love to receive, and I will be happy when you give me a present for my bucket list. But in green are the things I even don't know I could get, and that would make me super happy. So if you give me something, an unknown, you delight me. And that is what we're going to use to create patient and doctor experiences. We're going to provide them tools, ways to be much better for their customer player by always being top of mind because they provide me something I didn't expect I could get. That's what we're going to try to do. And there go some super basic things. A hospital which is treating end-stage cancer patients, which has a wine list like in a two-star restaurant. It's not because I'm an end-stage cancer patient that you shouldn't, well, treat me well the last few days. That is also delight. To these kind of things. The first devices, which stick to my arm, do no longer require a needle in my arm to take blood, but suck blood and basically collect the blood in a way that the patient is willing to share a data point without any friction. That is what delight is about, removing friction. Two really exciting things. These are the experiments we do in Japan, where in elderly houses we fly in a drone, and on the drone is a glass of water or whatever, sake. And the point here is that this becomes healthcare by default. I don't have to think. You don't have to nag me to drink enough. Well, I cannot neglect this. This is healthcare, which is basically so frictionless that I can, well, await that next experience, keeping me healthy. And so what we're going to try to do is to look to that delight ID with eyes also provided by the Heat brothers in a really nice book, The Power of Moments, where they try to say, well, if we look to the experience of being a patient today, well, a citizen tomorrow, can we look to elevation moments, boost the things which are not in the script? Can we provide pride to patients, saying, well, you see that I could do this? How powerful I turned out to be with that new tool you provided me? And can we connect these things? Can we make sure that people are willing to share moments of joy, moments of victory, moments of, well, dealing with being sick, right? And so that entire idea of using delights will be used to move to a value-based, outcome-based healthcare system, which I believe will be really, really personalized, will be no longer reactive, but proactive, will be always on where we are, so fully decentralized, and will be basically um, um, combining tech and combining human interaction in completely new empathic ways of dealing with care in hybrid care. So that is setting the scene, and that is where I would like you take to. So let me start with my guardian angels. The first one being the least tangible, fully realize that, but I think the one which will really change the world big time the next few years. And therefore I would like to start with the picture at the left, which you might have seen. This is an IBM hard disk, 1954, which required a plane to get transported, right? And still a few years ago, the fastest technological development made by man was our ability to increase computer power with 100% every 12 to 18 months. No longer so. The most amazing tech development made by men is our ability to identify the 3 billion digits, the DNA which provides our uniqueness, no longer in 10 years' time for $10 billion, but with the device you see at the right from Oxford Nanopore in something like 3 hours for less than $700. And the question is not who will pay for that. The question is how will hospitals, how will nations start to use this to the better, right? So let me give you a few examples. This was my father at the left, double infections of the lung, intensive care. And then people take some liquid out of the lungs, grow that on a plate, hope that bacteria grow, and basically decide which antibiotic to give based on which bacteria grow. After 3 days, nothing was growing, and my father was ready to die. So we took that little device, which I showed here at the right, to get all the bacteria in his lungs sequenced, compare that against a database of every bacterium we've ever seen, and in 3 hours we got the right antibiotic. This is from 3 hours, well, 3 days to die to 3 hours to treat, which is better, but not good enough because he got sick in the first place, right? But bear with me, technology allowed us to become way more precise in a super fast fashion. And then this happens. Two of the big pharma companies on the planet get sued by the state of Hawaii because Hawaii, where they sell a blood thinner like they do in the rest of North America, people in Hawaii are descendants from Southeast Asia, and they have 3 digits in the 3 billion, which make them unique, which make that this blood thinner is metabolized much faster. So these people need more to be effective, right? And so they managed to get these two pharma companies change the protocol. And the point I want to make is that if I see a patient coming in my ER and I have no access to his or her genome, well, there is 6% chance that my patient is not leaving the ER alive because I dose wrongly. So that is what I start to use now. I look to bits and pieces of my patient genome. And the real reason why we should pay attention is because we start to see the first 3D printed drugs getting approved by the FDA, which are really tailored to my genome, so I can adapt the concentration of the chemical into the drug based on the genetic profile I have. And for that reason, it wouldn't surprise you that we start to see the first marketplaces, platforms, where people can, instead of waiting till they get recruited in a trial, they can do the reverse. They can type in the mutation they have for other people, well, pharma companies to find them. And all of a sudden, we're going to reverse the model from I'll wait till I find the drug till the drug finds me, right? And in an extreme fashion, This is a fascinating development. This is Singapore, OncoShot, the power of platforms. Singapore is providing each of its citizens the ability to upload part of its genetic material, well, insight in the genetic material, to allow, when they get sick, when they get cancer, to find the trial somewhere on the planet which is most tailored to treat them. And I think if we're going to do this, not just for cancer, but for any disease, then we start to have a much fairer chance to even think about treating cancer in kind of an earlier way. And that brings me to this idea. There is a 12% chance that I can identify colon cancer in men. But if I tell it to men, the majority says, well, Koen, I'm not interested, because after that, you're going to put the tube, which you see at the left, in the back of my body, and I'm not too much looking forward to that. Well, we no longer do that. We use these capsules now, 360-degree cameras, which we swallow, which make better pictures than the ones we took in the past, and basically allow me to turn 1 in 5 men saying, yes, I want to be screened, into 3 in 5. So technology changes behavior. Technology allows me to find that patient so much faster that I become able to offer preventive care in a pretty cool experience. And if this doesn't work, this will do. This is the men's cave in a hospital in Haarlem, really tailored to, well, men, to get them into the hospital for prostate or colon cancer screening. And what you see before you see the doctor, all the paraphernalia for my favorite sports team. This is super delight. This basically makes the hurdle to get me into a preventive screen in a fascinating, delightful fashion. So let me take that one step further. I got my genome sequenced something like 12 years ago. That's my job, right? And if I would interview with you, I sent you my genome as well, just to make sure that you're absolutely clear that for me, not having or not using genomic data is ethically unacceptable. Let me explain. I'm predisposed to get blind, right? I don't know when, but the fact that I know allowed me to change one thing in my lifestyle. I take a supplement now, it's called lutein, which should be present in broccoli and cabbage and basically delays the degradation of the back of my eye. If it doesn't help, it doesn't harm. But I really got excited when the second piece of software as a medical device, we call it now, entered the market from a company called IDX, which allows me, without seeing an ophthalmologist, to scan my eye now, my retina, and to see whether the blood vessels in the back of my eye start to clot, so that if that happens, I can take medication which will work. If I wait till I get blind, well, I can no longer get cured. This is prevention, well, secondary prevention, if you like, of the future. I'm going to use genetics and software digital tools to prevent me from getting sick in the first place. And if it would happen that I get sick, I'm going to use this app. If you haven't used that yet, download it tonight. This is Be My Eyes. Blind people use smartphones as well, believe me. Now, Be My Eyes allows me, being blind, to to ask a number of my buddies to help me showing what I don't see if I'm, for instance, in a shop. And I can tell you, it will give you goosebumps. If a little lady is in a shop wearing a blue suit and ask you, can you tell me which scarf best fits with what I'm wearing? The point I want to make is that digital connects us. Digital makes us part of the community. Digital allows us to start sharing things amongst patients to learn and to get delightful, novel experiences. Now I hear you think, well, whoa. That genome thing, way too early. In my country, I'm not doing that. It's not there yet. So let's park it for a second. Knowing that health is basically defined by what I got from my parents and my genome, but for big time, my lifestyle, environment, and my social determinants of health. And so I cannot see you now, but just as a question, does anyone has an idea? What are the 2 most determining factors which will define how old you will get? It's the age your parents will have when they die, and it's your postal code, it's your zip code. That's the social determinant of health basically defining your social status, your access to care, right? And the graph you see at the left is a part of Chicago. And every suburb has a different color. There is a difference in 8 years quality of life, not kidding, 8 years quality of life, depending on the suburb you live. So on the picture you see, there is something missing, right? The lights are out. So I can tell my patient, you should walk more, you should do more exercise. But if it's too dark in the street, my patient will not do that. And my task as a doctor is to call the community and get the lights fixed, because that will help my patient go out and basically get her healthier. And that is the perfect link to the fact that using digital, we start to be able to have access to whatever data point we would love to have from our patients. And yes, while it's still early days for doctors prescribing apps, I would like to show you a few things which are emerging, which are upcoming, which in my experience really excite doctors as well. This is the first wearable which use electric currents to follow IBD, intestinal bowel disease and Crohn's disease, looking to movement in my stomach and my guts. A doctor who sees this and experiences this for the first time says, well, I start to realize what I could measure, which I didn't realize I could do. This is NeuroKeys. It looks to my typing behavior. And typing behavior and errors I make is a measurement to predict things like multiple sclerosis, or to predict the energy I have as a patient to do things right. And that is a data point I'm able to use. I think this is something you will hear from the founder of Neuralogics, but we have the honor to work with a fantastic Canadian-Israeli company which has developed the concept of a video selfie, which is already used for a number of years. But we have the first data now showing that people who get diabetes, which are pre-diabetic first, and which basically need the heart to pump harder to get the blood pumping around glucose bound to a molecule called HbA1c, that we can use a selfie from my face as a surrogate for prediabetes. So imagine that this WebEx call, this Teams call, this Zoom call asks you in the future, Mr. Kas, can I take your selfie? I believe, and we have the first evidence that people are willing to do that, that this becomes part of our next generation of, well, self-care, of hybrid care, where that simple selfie prevents me from things from striking. And this is not just, well, detecting and screening. We start to have the first digital therapeutics, which really do fascinating things. This is Achille. Well, this is Endeavor from Achille, which we prescribe to children with attention deficit disorder. We bring them into a game, a kind of Fortnite, or well, we do it in Roblox now as well. And basically, the game gets me back into, well, in rests. It treats my HDD using digital features, or this one. This is Kaya Health, German app, which based on my positioning, which is taught by my smartphone, well, a virtual coach on the smartphone, is able to manage back pain, low back pain in 3 months, at least if it's not an inflammatory disease. The point I'm raising here is that these kind of therapeutics in my country not reimbursed yet, but that apparently people are willing to pay out of pocket for these things. Because if that works and back pain is something you have been suffering for 6 years, spending 3 months, €100 out of pocket is something a lot of people are able to do. Not all of us, I fully realize that. But the point here is that moving digital is not only till that we get things reimbursed. I think we can start bring things to our patients where we think about smart ways where third parties pay for and get a way to shine, moving things forward in a faster fashion. This will become digital Viagra. This is really making sure that my erection problems can be dealt not just by pills, but by mental screening, right? And so we see this evolution of digital therapeutics, digital TTX, from moving away from just nagging me, you should do this, you should do that, to what I've just shown you, digitized versions of low-risk intervention, cognitive behavioral therapy, physical therapy, to adding or interfering with biological pathways. And one of the really fascinating ones, I believe, is metrhythms, which we now use in people with multiple sclerosis, which start to have a hard time to move swiftly and which get a sensor in their shoe. And the sensor measures gait, right? And the gait sensor is linked to my Spotify. And once the sensor feels that I'm going to slow down and will not be able to take my next step, my music starts to play harder. And that overcomes my inhibition, gets me through my walk, and basically destigmatizes me and prevents me from falling. And all of a sudden, I have created a delightful way to deal with disease. And so for people who might have an interest in these kind of developments, one of the things I do with my team, Health Scouts, we curate the database of every certified health app on the planet. That is not a big database yet. That contains only 290 apps, but at least you know that they are certified by the FDA or CE2 marked in Europe, and that they should, in theory, be trusted to be used in practice. But what we see then is that a lot of doctors till a few years ago said, I'm not interested in all these apps because the data generated by them, well, I cannot trust them. They're consumer data. They are not part of my medical dossier, right? And that changed last year. I think the first company which tackled this was Wittings, which is selling scales. How basic can it be? Now, Wittings allows me with an API from a company called Weightox to get my weight data into my medical dossier. And what happened this week might turn out maybe the most instrumental moment in digital health in 2022. It's the announcement that Fitbit, which became part of Google last year, now has an API which allows me to do the same. My Fitbit data can be read directly into my medical records. And I think that that will help, at least for people who are willing to work with something from Google, to get all of a sudden the link between my home care, self-care, consumer stuff into a medical dossier and to start playing with that. I'll get back to that in a second. Because if I look to what is feasible now, I think the example of Omada, which I guess you know, one of the fastest growing digital health companies in the States, is completely built on providing people a scale and human coaching. So they get me, if I agree, into a 3-4 month program where they teach me to change eating behavior by just getting me on the scale and talking with me. Not doable with an avatar. Real human people talk with me, hybrid care, and these guys have proven that you can get eating behavior changed. But can we make it better? Look to this. This is Clue. Fascinating. Clue has proven that my wrist movement can be used to find out whether I'm drinking soda, a coffee, or tea, a glass of wine, or beer. In 2 years' time, they got enough data to convince Medtronic, one of the big medical device companies, which has a big program in diabetes management, to acquire them. And so Medtronic is now launching this service to ask me, well, Koen, are you willing to be helped by lifestyle management, where I can look into what you eat, drink, and sometimes you get a suggestion from me, maybe to skip the soda and move to something else. A data point from as a wrist becomes a surrogate marker to start changing lifestyle behavior. And you can start to add extra levels to that. This is a fantastic augmented reality application. This is the first application which allows me to scan the menu in my restaurant. And if based on who my patient is, I can program what I don't like him to eat. And so the app in 3 dimensions in AR tells me which plate to skip. You have the restaurant providing this to me versus the restaurant which is not doing that. Who do you think Gen Z will move to? That is how you have to start building experiences. It shouldn't come from healthcare only. It can come from my retailer, my restaurant, which starts to install this kind of tools and becomes a delightful restaurant where this becomes something we can experience, right? But the real excitement is this. A few years ago, we sent 6,000 people with diabetes home with a super basic step count. Split them in 2 groups and proved that 3,000 patients, which did an extra 2,000 steps a day, in 1 in 5 cases didn't get more sick, they didn't get morbidity of the heart, and they in 1 in 5 cases, even got better. They reversed from being diabetic to pre-diabetes. And that was the first proof that maybe lifestyle, maybe getting people walking in the park is the best drug we could sell. And then I hear people think, yeah, sure, we know this. We have to change behavior, but that's way too hard. Well, I don't think so. Look to this one. Pretty soon, you will be able to program the favorite character from your favorite series as a coach on your smartphone. And only if you've been moving enough, you can watch the next episode of your favorite series. I have seen Squid Game 2 already. You haven't. I got a pretty cool experience. You haven't. And I remained healthier. And that is something people are able to sign up for. And it shouldn't be Netflix. It can be with a streaming service from your country. It can be with a sports hero, with a musical hero from your country. Everybody has a hero. But if that hero becomes my coach, tells me that together with tech, you can become a companion which is able to reverse disease back to normal, I think you have people's attention. And one of the fantastic experiments we're involved in here is redesigning the pharmacy, where we try to see whether we can sell, instead of just pills in a pharmacy, whether we can sell lifestyle behavior so that people come to the pharmacy not to ask, well, Mr. Pharmacy, I got a prescription to be treated, but they come to the pharmacy and they ask, Mr. Pharmacy, I want to be treated to remain healthy. And turning that model upside down shows me that the world starts to get ready to pay attention and to spend money in real prevention. I'll come back to that later. Now, it goes much further than just looking to exercise or to what I eat. This is an experiment we've been doing with the Parkinson's Foundation, where listening to my voice is able to identify Parkinson's because I start to pronounce my vowels differently 2 years in advance. But if I find out that, you can treat me. You can no longer treat me if I wait to look like treated with Parkinson's. So the question here is, how do we build the trust that people are willing to use this kind of technology in their environment without fearing that someone else, one of these big corporates, just do something with the data? I'll come back to that in a second. Or this one, we moved into a real mental health crisis. And this is one of the things I use. This is Woobot. This is my Psy companion 24/7 with me. I don't know whether it's he or she, but if I have some fear, if I am nervous to get on stage, if I am procrastinating, he or she gets me through it, right? And if that is something where you say, well, that's not something for me, one of the things which I think will really be instrumental in dealing with changing behavior is the fact that the avatars I started to talk about earlier, that we can start to make these avatars really, well, not just good looking, but we can make them like who love we are. Imagine that everybody, which I believe has someone he loved, someone he trusted, a grandparent, someone he says, well, if he explains things to me, I'll believe it. Imagine that we can do these things. So this is an avatar as well, which is so real that it sees my expression. If I'm sad, she or he will not reply in a happy fashion. She will react in a sad fashion as well. This is soul machines, right? And we're working with soul machines, the guys who basically did the CGI for Avatar, for Tron, for Kong, for Lord of the Rings, trying to build digital humans and trying to see how we can bring them in the care path for patients to help patients not to deal with things which are, well, cold, but to deal with patients, with people who they trust, which are empathic and which are able to change behavior. And that is why, even while people might sound this kind of naive and find that these are investments way too early, that we really spend time in experimenting with things like apps to treat incontinence, where the app is basically providing yoga, is basically providing training, is basically providing mental advice. It's the reason why we are really interested in trying to find out how a digital human can help me. I have tried to commit suicide twice, trying to prevent that, trying third time. So this is an example of which is a digital therapeutic trying to anticipate suicide, right? Or where we can start to use this typical metaverse stuff. And this is Oxford VR, which provides me a tool with a VR glass to deal with crowds. I don't dare to go in the metro. I feel too kind of overwhelmed. Well, you can teach me that in the comfort of my home with VR glasses till I manage to do these things. And that brings me automatically with something which I don't think is a gimmick, but I think which is really going to help us to be better healthcare providers, but also become more excited patients. This is urgence. While I dare to talk to you about my cancer, my diabetes, I have a very hard time to talk about people about my mental issues, right? But apparently, people, are able to do that with avatars, with, well, digital interactions. And so here I'm going to show you something I do if I go with my psychiatry patients to an environment which they can pick themselves. They don't come to me physically. They say, well, I would like to go to a place which basically provides me comfort. And for one person, that can be a sports stadium. For someone else, that can be a museum. And let's take the example of the museum you see at the lower left side. So I go with my patient in that museum, and you see at the walls there is some pieces of art, right? So the piece of art you see at the lower left side is the piece of art you see in the upper right corner. And I'm standing with my patient digitally in front of that painting, and my patient says, well, Koen, that is how I sometimes feel. All these letters coming down right and left from me, they overwhelm me. Thousands of emails I have to read, 300 WhatsApps I have to reply. But if I feel that I can stand under that umbrella, I feel safe, I feel strong, and that's where I find rest. And that piece of art is an NFT. It has a digital signature, which allows me to push a button to download that piece of art onto the smartphone of my patient, and all of a sudden my patient gets a unique piece of art by a real human to look after every morning before the day starts. By simply explaining this gives me simply goosebumps, because the extension of the analog world with the digital one gives me new ways to become a personal health provider. And just like Franklin once said, if you tell me something, I forget. If you teach me something, I might remember. But if you involve me, I will become part of this. I think that the entire metaverse allows us to do really exciting things. This is what we do with cancer patients if we explain what, for instance, a fibroid is. Look to this. The patient stands in the middle, right? And so I explain as a doctor that normally what I see is at the left is normal, but what I have is at the right. And all of a sudden, you see my tumor. And the doctor will explain what is going to happen during surgery. That is something which is so important, that you can send me home, not just with bad kind of information, but with something which I can digest in my time when I'm ready for that. That the entire idea to use digital is basically something where we're going to use digital not just to change the healthcare system, but to educate patients, no longer being patients, but to educate healthy people what it takes to remain healthy. And so the power of digital, in my opinion, is not just a way to become more data-driven, personalized, and precise, to be always on and to use digital as a therapeutic or preventive tool, but we will be able to empower our patients to think about themselves in kind of a default fashion into a really hybrid, engaging, and such an immersive way that it's kind of like going to Tomorrowland, going to Disney, being part of that healthcare system. And that brings me to my last part. If that is a world we're going to move in, you could argue that we, well, at some point will never be offline, always on. And the good thing, you might say, well, that data, that wisdom, allows us to anticipate things from happening and allows us to delete the biggest friction ever in sick care out of the way. The biggest friction is getting sick in the first place, right? Now I hear you think, well, whoa. How on earth are we going to deal with privacy, with ethics, and immorality. How are we going to build that world? How will that look like? And I think this is the answer. For people who haven't been to Disneyland in the States before, if you're going to do that once, you should do that once. Before you do that, you get a box sent home with magic bands. You see it right. And these bands have your name, the name of your partner, the name of your kids, and you start wearing the band, you enter the park, and you don't have to pay. That's the product, right? But you know what I hate when I go to Disneyland? That is waiting 45 minutes in line in front of Avatar with my kids. Not nice. 3 minutes before 3 o'clock, that little band tells me, Koen, if you leave now from where you are in the park to Avatar, there is no line. And that's a pretty cool service. I'm willing to give up on a square meter where I am to get a service in return, right? So if I would stop here, my point is your patient is willing to give you a data point if you give him an experience in return. But the real cool thing was the following. We came at the park and my wife got flowers. Would it be a problem if she didn't have received flowers? No. But I filled in a form with my birthday, her birthday, the kids' birthdays. My wife's birthday is the 4th of September, and we came there the weekend of the 3rd of September. My wife didn't give consent to use that data point, but the flowers we will never forget. That is delight. So give my patient, give my citizen something he didn't expect to get, delight him, and he will be on your term. He will be willing to work with you to get him helped. So can we envision 24/7 tracking? This is Japan. In Japan, if my mother would live there with Alzheimer's, she would be allowed to leave her care home. She will get lost, right? But she's tracked 24/7 with a sensor. The, the kids of my mother, well, I would love that because it gives her an experience to be free, and I feel confident that you can do that. So take that idea one step further. She gets the belt, the one you see at the right part. It's an airbag. If she falls, basically the belt blows on and she's prevented from getting a breaking bone. And so that is, I think, a very nice visual showing that prevention can be tailored using tech in almost an invisible fashion to provide me pretty cool experiences. And that's what I'm going to try to summarize in the very last few slides. This is a picture of my city. I live in Antwerp, the center of the world. If you leave Antwerp, you go nowhere. And part of our city, we are an experiment where we monitor all the things which happen. The number of people getting through red light, green light, orange light, the wind turbines which are on, the airlines which fly over the city, but also very accurate temperature, pollen, pollution, allergens in the air. Combined with these data, my health data, my genetic data, my brain scans, my voice data, my social media data, basically they define who I am. All these data define Koen Kas. Now, so what? Well, this is the so what. In 2022, if I would think about building a new car, I will no longer be able to build a new car. I will not get the resources to do that if I cannot prove on a digital copy on a car which is built yesterday that I can make that car better. Why can we do that? Because we have so much sensor data from creating a real car yesterday that we can make a digital model, which you see here. And so I will need to prove that I can make it more aerodynamic. And if that turns out, I get the resources, the money, the people to build that car. I guess you can already expect what my next slide is going to show. In 2022, we're finally able to envision that we can start to build digital twins of human beings too. That we start to have not enough yet, but enough data to mimic part of a pathway, part of the disease in a digital fashion, and that we really can bring the aspirational goal forward. Incidentally, I was part of a European project where we tried to raise 1.1 billion euro to design by the end of 2030 a digital twin for every European citizen, which is able to predict the 5 most common chronic diseases. The fact that we could align 50 labs, 20 countries against that vision provides me, well, the hope and the belief that we can change the world starting from a white page. And therefore, I'm going to end with something which might be completely novel to all of you, and that's the following. You know the internet as we know the internet, right? But I think that the entire idea that currently the internet centralizes things, that while the big hope that we once will move to a world where things are decentralized and can be governed by ourselves, that we are one step closer to reaching that goal. And one of the new ways to look to decentralization on the internet is a project called Solid, basically invented by the gentleman who also invented the first generation of the web, Tim Berners-Lee. And what Solid allows is to provide every citizen with a personal online data store, a POD, a POD. In my country, Belgium, is about to launch this system as the first citizen-centric data platform where every citizen will basically get a vault where he or she decides what to upload, where the data do no longer go to the States, like in China. They don't go to Facebook or to Google, like in the US, but they remain with me. And you can come with a service, knock my pot, incentivize me, reward me, and we believe we have the first evidence that people are willing to use this, that this is what we are going to able to use to change the entire healthcare system from let's wait till get cured to a proactive way to remain healthy. And if I have to summarize all the things I've told, I think I can do that best by asking people who haven't seen the movie yet to download Big Hero 6 this weekend. Big Hero 6 is about 5 friends which get to know a sixth marshmallow inflatable computer doctor, Baymax, you see here at the left. And Baymax lives in a tiny, tiny, tiny box in my house and sometimes appears combining omic data, sensor data on the internet to generate big cold machine data to make devices more effective, but basically to change my behavior and to create delight. And so this way, I'm gonna send you home with what question? What are you gonna do for your patient, your partner, your client, your hospital, your pharma company to delight someone tomorrow? Because delight is something you cannot cover, you cannot top, and allows you to become top of mind and never be old-fashioned. Thank you so much.
Thank you, Koen. Lovely delivery as always. The entire team on our end has been listening extremely carefully, and I think we're literally mind blown. May I ask you a rather personal question? And I'm sure there is an interesting answer. Why do you do what you do? What's
Yeah.
your personal driving force?
Yeah, my personal driving force. I think I explained. I'm trained as a molecular oncologist, and the very first patient I've seen was a Swedish doctor, which a Swedish farmer, who lived in the north of the country till the tumor he got became too large, and basically he had a second face. He had a twin face, and we discovered the reason why that happened, and that was one genetic mutation, which basically built an extra face. And that gave me the insight that if that is feasible to understand, then a little bit of genetics might allow me to understand how I can, well, redesign humans almost, right? And then that discovery of that very old Chinese model where I was paid to keep my patients healthy, that together with these technological insights gave me the idea, well, will I want to spend my life dealing with end of life, or would I try to build a world where at the end of my life I can say, well, I've tried to build a world where I no longer need to get sick, where my grandchildren no longer need to get sick. And I found that the more aspirational way forward. And it became, and that's the real answer, Georgie, it became a solution for my mind as well. You don't want to have my mind. I find everything interesting. But by finding everything interesting, I had to find something to channel all these inputs. And what I do now is with an entire team, we collect new tech, new design ideas, new art, new business models, and they pass my mind, and we make projects which we present to pharma companies, to big tech companies, to nations, to inspire them how they can innovate, and this way all these projects together, they help to build my dream, which is having a world in which our grandchildren no longer need to get sick.
Lovely. Thank you so much for devoting on this. And I would allow myself to actually forward one more question that we have
Sure.
gotten from the audience, or at least one that has stood out. I'd be super curious to find out what do you think. So Dr. Levici has asked us, Dr. Kas, how far are we, or what are we missing from the time when medical analysts, not doctors per se, will be able to capture OMICS data, clinical data, mental health data, and social determinants into a meaningful, intelligent manner?
Yeah. So there is a lot of bits and pieces. We can do a bit of each of these parameters, but I think what we've been missing, because of the way we are being educated, everybody thinks in silos. So a rheumatologist thinks rheumatology, a dermatologist thinks dermatology, a nurse, well, does do what a nurse does. But I think what we need is show people how rich the world can look like if we start to combine, well, silos together. And I think what helps to move the needle forward is to show someone with an expertise, and everybody has an expertise, to use one data point out of his expertise and show him how that makes his life richer. And not so much richer in a monetary fashion, but in a delight fashion. How can I provide more to my patient? And let me give you one example. You might have seen Minority Report in the past. Tom Cruise can predict crimes in the future. And you've seen these visuals where he sits in a cockpit and he collects dataset 1, dataset 2, combines them and gets a new insight. And I think that is how we have to move forward. If we can ask a doctor, what is it that you would like to know that would make you a better doctor? And we show him that it's very easy on a small platform, in a small tool, to get him with that data point, that is the way forward for people to say, well, I'm going to open up beyond my silo and I'm going to try to see where I can learn from others and build something which becomes way more holistic.
Lovely. And again, from Dr. Levici, actually is a follow-on question to the first one. Which doctor can apply to know their patients and make a wiser decision and wiser choices?
Yeah. I don't know whether I understand the question exactly, but let me first try to give a trial on who the doctor is. There is an issue with doctors. If a doctor who gets his degree this afternoon would have been present in this presentation, right? I think he will tell us that 80% of what we've been talking about, he hasn't learned at school. That is the biggest challenge, that our educational system is not up to par with what is possible. And so 8 years ago, when I started to talk about for doctors, they said, well, it might have its time, we'll see, come back when this starts to mature. Now, if I give a talk, I have an average 3 or 4 doctors who ask, well, what can I do to be part of that future? So that gives me at least the confidence that doctors start to get ready, and not just the ones which are 25 or 27, elderly people as well. That's one. But two, I'm part of the University of Ghent, and they gave me a mandate to bring digital technology into the Faculty of Medicine, which is almost kind of an Alibaba entering the the Faculty of Medicine. But that is really exciting because I don't see that people are against things, but people which have been unaware, and you get them the story right, are really willing to start adapt and to say, well, I'm going to do something extra on top of my workload if it's something which you explain me why it will make me better. So it should not be something top down you put into the system. You have to make sure that you do a bottom up co-creation with your doctor. And then in my experience, Georgie, people are willing to adopt, to endorse, and to start building together.
Lovely as always. Thank you so much for the impactful presentation. As a side note to you and everybody on the session, we've kept on receiving actually more than 5 people reached out personally to the hosts saying how touched they felt. either by the information presented or because they themselves have actually been in the position of the patient with various
That's it.
conditions and having leveraged and benefited out of some of the technologies you've just mentioned.
Wow,
So,
fantastic. Yeah, that's why you do it. That's how you get goosebumps. I still recall the first time I presented an app to manage migraine, I mean, and cluster headaches. I think people said, well, wow, I will write that down. And I think a week later, not a week, 3 weeks later, I got 15 emails from people saying, well, it's something I learned from you. I started to use that and my problem is solved. I mean, how cool is that? Yeah. It's awareness. And that's why what you do today, Georgie and team, is so fantastic. Yeah? Providing a forum for people to see how the future could look like without feeling fear, without being overwhelmed, but seeing that technology will make us more human. That's absolutely key. That technology makes us more empathic.
thank you. Thank you so much.
Okay?
It has been a privilege to have you here.
No, the pleasure was mine.
Feel free to stay around. By the way, Neurologics, whom you've mentioned, are going to present Take a Selfie, Know You're Healthy keynote a
I
bit
see, I
later on.
see, I see, I see.
So
Yeah,
there you go. We are trying to connect the dots, doing our minor contribution. Um, Very happy and honored to have you here. Thank you so much. Excited
thank you.
for
Okay,
next possibilities to
okay.
work and tinker together.
Yeah, that will be in the metaverse. Eh? We're gonna do that. Eh?
Let's do it.
Yeah,
Let's
yeah,
do it.
yeah.
Absolutely.
Bye,
Thank you.
Josie. Thank you so much. Thank you so much.
Koen, all the best.